Microneedling, what do we use it for? Now, I'm coming back to melasma because microneedling is actually used for deep acne scars, and that was a continuous wave. And if I use continuous wave microneedling for melasma, it's going to get worse because it generates a lot of heat. Now remember, melasma has 4 components. It's got a pigment component. The big brown spots on your face is pigmentation. Supporting this pigmentation, we've got inflammation in the dermis. The dermis is not healthy. Got a leaky basement membrane. The melanocyte that's supposed to stay up here leaks through the basement membrane and goes into the dermis. We've got overactive blood vessels. The vascular endothelial growth factor, VGF for short, is a bit higher in the dermis. So these overactive blood vessels feed the melanocyte and it makes it a little bit more active. We try and use 4 different lasers to break the melanin into smaller pieces, a second laser to decrease the inflammation, third laser for the overactive blood vessels, and a 4th laser to repair the basement membrane. But the most important of these 4 is breaking the pigmentation, because no matter how much I do on the other things, if I don't break the pigmentation into smaller pieces, the pigmentation is going to stay. So those 3 is for control, and that is for breaking the pigmentation. Pulse radiofrequency microneedling was designed for the overactive blood vessels. It goes down into the dermis, it decreases the activity of the VGF, and so these overactive blood vessels that feed the melanocyte become a bit suppressed. And we found that these needles also repair the basement membrane and it decreases inflammation, and really it's one of my best skin firming treatments. But remember, it does not have that component of breaking the picmentation to smaller pieces. So I tell my patients, when you're trying to remove the melasma, you really need to do the laser, the picosecond laser, to break the pigmentation into smaller pieces. For control, then you may want to add the pulse radiofrequency microneedling to be able to control the inflammation, basement membrane leakiness, and the overactive blood vessels. If I put too much power on the pulse radiofrequency microneedling, or I go too deep, and some of the machines don't have that shallow depth, it can be worse. Some of my patients, in spite of everything we do with the pulse radiofrequency microneedling, it still gets a little bit darker. It's just a variation. Not everybody responds to the pulse radiofrequency microneedling. So what we do is we say, hey, you're not suitable for this, just stay with the lasers. So pulse radiofrequency microneedling, very, very good for control of pigmentation, skin firming, decreases the inflammation, increases the growth of collagen and elastin in the skin, makes it very nice. But as a primary treatment to break the pigmentation, it lacks that component of breaking the pigmentation into smaller pieces. So you really need both. If you can't afford the pulse radiofrequency microneedling, leave the lasers. Don't do both together. Add that later on. It's a better option.